So hey guys, what's up? It's Stephen Dunn with CORE Therapy and Pilates today, and what I want to do is interview Dr. Danny on his most recent education since he's been with us at CORE. So first of all, Dr. Danny, thanks for joining us today.
Sure.
And he's been working with us now for I think about 5 months.
6 months.
6 months?
6 months.
In that time that he's come on board to work with us, there's been a lot of educational opportunities that's already that he's already taken advantage of. And one of the things I like to do is get together and have a bio update. And we can update the bios on the website, but I like to just kind of have a discussion and talk about it because it goes into a much greater depth. And so with that said, tell me a little bit about the myofascial cupping therapy, the cupping therapy.
Yeah, so it's a great adjunct to what we do with improving core stability, any kind of the exercises that we do along with some of the other manual techniques that we use. So it's a good adjunct therapy too, and I've utilized it a lot with people that have trigger points, or their muscles are really stiff, or they got restrictions in your fascia, which is kind of like the glue, I had a patient say the connective highway of your body, which I thought was pretty cool.
Yeah, that makes sense.
So yeah, and it helps with but there's a bunch of different uses for it. Those are kind of the big ones that I've used it for, but there's a bunch of different ones. You can use it for desensitization for pain. You can use it for helping with swelling. You can improve muscle flexibility. So it's a versatile thing, and it also helps the therapist, so we don't have to use our hands as much, which is another benefit.
Got it. So you're kind of using it in conjunction with manual therapy, exercise therapy, everything else you're doing. So it's not something you're doing exclusively for a whole hour of your session, but it's something that's being used along with everything else.
And I've had a couple people come back after they finish their plan of care, and just to kind of help with some stiffness and all of that, and just improving some flexibility of their muscles. So along with what they've learned and continue to do outside of here.
And is that a scenario where they're coming in for a full session?
No, it's usually about 20 minutes.
Got it. And so something coming in to basically just have the cupping, and then having an opportunity to ask questions about any homework or anything that they're doing.
Correct.
So these are people that have been, say, discharged from Medicare, and now they're doing their homework, but they'll come back in a time or two or as needed to get the cupping, something that's not covered by Medicare in this situation. And again, you two are staying in communication and helping further the plan, even though the plan is over.
Correct.
I like that.
Yeah.
Okay, that makes a lot of sense. Because there's certain things that just aren't going to be covered by Medicare. If we're implementing cupping within that hour of therapy in conjunction with everything else, they're going to cover that. But if you to just do cupping for a session, they're not going to just cover cupping.
Right.
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 All right. I love it. And so with cupping, when Dr. Danny and Dr. Andy both finished their training in cupping, I brought both of my kids up here to kind of be the guinea pigs, myself included. I've been a guinea pig and had some work on my neck and shoulders, had some work on my elbows. But the thing that was the most impressive for me was watching my son, who's 13, who has really, really tight hamstrings. Within a matter of about 3 to 4 minutes of treating his hamstring with the cupping and some active stretching and some active movement while the cupping was being applied, he really picked up a lot of range of motion in about 3 minutes. The total amount of time for setup and everything was about 5, but I was really impressed with the amount of mobility that had improved like that, without any traditional stretching, without anything traditional at all. It was very impressive. So just one of the things that caught my eye. For me, it was helpful for some of my neck tension, and that was one of the things that I noticed. So with that said, thanks a lot for your commitment to getting better and serving the people of Westlake and Austin. And if you haven't been around and seen Dr. Danny, then He's got some great Google reviews so far. We'll post those at the end of this video. But thanks for watching, and thank you, Danny, and